Yeah, good morning, Dr. Sushil.
Yeah,
I'm Anand here. So this is regarding AI in cybersecurity. To begin the interview, I really appreciate and thank you for joining us today. To to start this interview process, I would like to ask you to introduce yourselves
yeah.
briefly.
I'm Dr. Sushil Meher. I'm looking after the whole IT activities in All India Institute of Medical Science, New Delhi for last 32 years, and I'm really passionate about the AI because AI is a new technology which is bringing up to the all the industry, including healthcare. So last 32 years in the healthcare, definitely my focus always be towards the healthcare. But challenges is almost same, but more challenges we faced in the healthcare. Okay, and second part is that the beauty of AI, why it is I'm talking about it. Last 20 more than 20 years, I am teaching the post graduation students to on AI.
Oh,
So it is
amazing.
not a new thing for me, and it is a very passionate subject. And uh, AI, what people they speak today's AI is a new technology. Is not a new technology. It is already been there. You can't believe it. When I have passed out in 1988, at that time my elective final year semester paper was AI.
Oh,
So at that time also AI is there.
yes,
Okay,
sir.
but AI is not been used because of the lot of other things are there. Uh, that's why people have not adapted it. But that time has come today that people have started using it, the AI. And the second part is that I'm looking after infra, I'm looking at the application security, then networking, and many other things which has been related to the research area in the healthcare, and simultaneously uh, uh, the guidelines, laws, everything's to be implemented, everything's here, the compliance issues, everything's we have to look after it. Yeah.
Yes, thanks for that introduction, sir. It was really nice to hear that AI is very old thing in the sense you began in 1988 itself,
Yeah,
1998 or
yeah,
so.
yeah, yeah.
That's very interesting, sir. My next thing which I want to know is that see you since you said that it's very important in the healthcare industry, that's cyber security and AI in cyber security. What kind of challenges actually healthcare faces, sir? We are really interested to know this.
Uh, see, um, you must have heard about uh, the attack, cyber attack in AIMS New Delhi. Okay, that is 23rd November 2022. Nobody have expected that healthcare can be attacked in such a way that it will be influence everyone. This is the eye opener for all the industry that this kind of a attack may be happen to anybody. And many CISOs I have discussed with them after the AIMS attack, the industry really looks towards that which they're supposed to have been secured. The top managers started talking to them. No, it is a issue basically, and we have to be more careful on it. So that's why I say it is an eye opener for everyone for that attack. But from that attack, we have learned that we're supposed to have a good resilient system so that you can recover as early as possible. You can't believe it. We have a backup, zero loss data is available, and that has to be recovered, and we have started using it. So because we are not that much of aware that that's supposed to can be happen to us, but still we are always being alert about that. We're supposed to have a backup. Any incident, it may be a cyber attack, it may be a fire, it might be any major damage to our data center. So at that time, the data has to be supposed to be kept in such a way that it can be used in future. And it is an institute for the research. That's why data is most important for us to keep for a longer time. Since our digitizations, all the data are with us and people are using that data on research. Now we come to the how healthcare is different. Because healthcare, why it is different? Uh, First of all, why healthcare is vulnerable, you have to look into it. Healthcare is vulnerable because what I have seen, and many agencies they have made the study that that the attack which towards healthcare is more than the any other domains.
Okay.
Okay, and recently we have seen that 24% of increase of the attack in healthcare, and it is the highest number of the attack in the healthcare domains throughout the world. Uh, because see, uh, in one magazine it has written that if you ask to someone to hack somebody's accounts,
Yes.
bank accounts, so they are charging from $10 to $30. But in healthcare, if somebody asks to hack the somebody's health records, they are charging more than $40 to $400. Why? So there is a lot of demands in this area is there. That's why people have started to hack the healthcare records. So this is the first of all, it is more, we are more vulnerable towards the hackers. Okay. Second part is that every organization is regulated properly. Okay, if we talk about banking,
Yes.
RBI has a lot of guidelines, framework is there. SEBI has given a lot of work there, and they are continuously following it up and upgrading their frameworks. But in healthcare, it is not like that because healthcare is as such, the digitization has started. If you see after COVID, large scale of digitization has started in healthcare, but the framework is supposed to be come out. It is not there. So
Okay.
people have started using the applications, but how to make it secure, that is not been done. And second part is that many of the organizations in the healthcare industry, they do not have the proper trained manpower to manage all these things. Fourth one is that if you put the cybersecurity some framework,
Yes.
it will hamper and it will slow down your healthcare services.
Oh, okay.
Okay, let's take, if we talk about the credential, means your credential, your password supposed to be always being changed after 2 weeks. Let's take the guideline, major guidelines is followed, and the string supposed to be 12 character. It is very difficult to manage it
Yes, sir.
because a healthcare organization is as such that when a patient is treated to a doctor, okay, it is not a single doctor is treating, it is multiple doctors are treating.
Okay, sir.
Okay, and their transaction is very fast because someone is coming this time, the next time some other doctors will come, which is might not be assigned, but later part it has been assigned. So how he can retrieve the records? As per the government guidelines, the patient record can be retrieved by the treating doctor.
Yes, sir.
So if some other doctor is coming for the treatment, you have to assign him this patient, then he can accessible. If you put these restrictions, then it is a issue.
Yeah.
And without getting the credential, he cannot assess the record. He can't give the treatment. The process will slow down. So that's why the adoption of the uh, act or guideline, it is a typical task in the healthcare domains. And but in future, what way it will go, I don't know. But today's days, really healthcare is a very vulnerable as compared to any other domains. Yeah.
In this case, will biometrics help, sir? Just face facial recognition instead of credentials and all. Should it be? Should it make? Will it make it faster?
No, I'm talking that way. It is there. Credential is required, but that credential supposed to be assigned by the authority to
Treating doctor.
assess this record.
Okay, sir.
You got my point.
Yes.
See, the first. First objective is that the treating doctor can assess the patient record, his patient records, not other
Okay.
patient records. He
Yes, sir.
has to assess the other patient records. He required the permission to assess
Permission.
that one. Who will give the permission? The treating doctor will give the permission. Yes, I'm assigning you.
Correct, sir.
If he's
This
not
will be
given, yeah. So that process takes time.
yes, sir. True, true, true.
You got the point.
Yes,
And
sir. Yes.
second part is that, particularly a very large healthcare setup, we are around more than 4,500 beds.
Okay.
Okay, 16,000 patient in single day OPD, people comes. So the scale is very high. So it is very difficult to make it. Let's
Yes.
take, let's take, people's patients are coming for the hospital to the OPD on appointments.
Yes, sir.
That is, that is 30% of the quota is meant for the appointment systems. They have to come on appointment system. If the doctor, one person has taken the appointment to a doctor and that doctor is gone on leave
Mhm.
on that particular day, you
That
have to
itself
assign to
is.
other doctors,
Yes, sir.
which is a very tedious job. It is possible, technology is there, but making this as a working system, it is very tedious job. That's why
True.
it is challenging for us. There's many
Yes.
examples are there, but it's a one example which can you can understand
Hmm.
that if you make the things more robust, then things will make slow. And if it's slow means you are losing the doctor's time. Doctor's time's losing means you can't give a
Yeah.
high number of services.
Yeah. Very interesting, sir. In fact, this case. Sir, you talked about zero loss security measures, something like that. Is it same as zero trust security models?
Yeah, zero trust. What we talk about, basically very simple
Uh,
to everyone. Zero trust means don't trust anyone in the cyber
yeah,
world.
yeah, exactly. Okay.
Okay, and we will apply everything. Okay, see, we have to make a zero trust framework based on your requirements.
Yes, sir.
Okay, uh, if somebody is, let's say we have many healthcare machines are there, laboratory equipments are there. Okay, it is connected with a third party software, and their software is running on XP, Windows XP. In that cases, your endpoint solutions,
We know.
your EDR cannot be installed there because this is outdated software. So you have to make the framework in zero trust. You have to bring out the out of your layer zero trust, and again bring it to the zero trust layer, because your what is your problems? Problem is that you have to secure your data and identity. Two things. Hackers are looking towards two things. One is the data, another is the identity.
Yes.
And what is the process of your data? You have to look into it. Whether your data is in the process, in the motion, or whether data is rest. In that concept, you have to put it and put your solution on place. Definitely, zero trust it will help you.
Yeah. As you said, it is identity also which they
Yeah,
actually which matters. Uh, what about internal threats, sir? And there will be
yeah.
anomalous behavior among the users itself, right, sir? Internal users.
See, uh, more than 90% of your attack is internal.
Okay.
Okay,
Okay.
because the users what has been given to you, they are using it. They're supposed to be aware and they're supposed to be trained.
Yes, sir. Yeah. Training. Yeah. Very.
Yeah, yeah. Continuous training program supposed to be there.
Yes.
Okay. See, the hackers they know it. The ultimate loose side is the endpoint. Okay, that's why is we have more than 25,000 endpoints.
Oh my God.
Okay, we
Huge.
are you are allowed to the patient to use the mobile to download their lab reports, their distress summary. There is also endpoint to us.
Yeah.
So internally, what it is there, we have blocked all the USB and internet access.
Yes, sir.
We are strict on that. We do not listen to it.
Correct, sir.
Those who have given to the particular nodes, we have all the nodes are there in India. Okay, but some nodes it has given to the internet where the major application cannot be accessed on that node.
Mm.
Okay, let's say I have taken internet.
Yes.
In that node will not be access to our application which is vulnerable.
Okay.
Second part is that always users has to be trained.
Yes, sir.
Okay,
That is true.
and the way of training is that sometimes you send some malicious mail.
Mm.
Okay, and how the users are behaving it, that framework we have to make it. So
Yes.
you know that let's take the holy was 2 days before. You
Yes, sir.
give some holy message and send a malware. How the user behaving is it, and continuously you will send it. You
Yes.
know that some users are not behaving properly after getting the training,
Mm.
so they can be warned properly also.
Okay, sir.
Okay, and you can put in your SOC that particular that node because the MAC ID as well as the IPs always be watchful because that user behavior is not up to
Yeah.
the mark. Yeah.
Yes.
So,
Correct.
and we are putting the users rating also who are good, and annually they will be awarded that your behavior is acceptable range, so that means in that case other people also motivating it.
That's very nice measure, sir. Actually, if you,
Yeah.
at the same time, the lower rating people should be trained
Yeah,
immediately.
yeah,
Yes.
yeah, 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 yeah.
Yes, sir.
And this is
That's very
awareness
nice.
program. You can say it is awareness program. Okay, these people are very means sensible for the cyber attack, and these people are not.
Yeah, that's very nice, sir. Very
We
nice.
do not disclose that these people are more vulnerable
Yeah.
user. Okay, but we disclose that those are good.
Good. Yeah.
Good.
Okay.
Okay, and second thing is that those who are more vulnerable users
Mm.
will force them to attend the
Training
event.
sessions.
Uh,
Yes.
Training as well as the event. So they will see
Yes.
that these people are good. I am a bad actor.
Yeah. Very interesting.
Okay.
Nice, sir. Nice.
So
Mm.
internal feeling will develop it.
Correct, sir. True. Very true, sir.
Yeah.
It's
And,
nice.
and, and next time we are planning that those who are very good actor for our cyber security will give us some kind of batch.
Mm.
Okay. When they'll move around because we have
Right.
16,000 permanent employee
Mm.
and another you can say 6,000 is contractual employee. So total it is about to be 20 to 23,000 people. And if we put 100,000 people with a badge, everybody will see that he's a very sensible guy.
Correct, sir. True. That
Yeah,
that
that
will be.
motivation other people will get it.
Yeah. That will
So,
be very impactful. Yes,
yeah,
sir.
that will give the impact to the organizations. And what we have done it, next year we are planning for it, and the cyber security week will facilitate here also.
Yeah. Yeah.
Yeah.
Nice. So, one more question, sir, about because you said there was an attack in 2022 at Ames. Maybe after that, number of false positives might have increased because you'll be more wary about the cases.
Okay.
Right, sir?
Let's see. After the attack, you have to know that why the attack has come up.
Yes.
You need a proper investigations.
Mm.
After getting the investigations, we came to know that where is the root that the ransomware attack has happened. Okay. After that, we have changed our whole framework.
Okay, sir. Fine.
I advise to everyone when you are compromised, you have to change all the policy as well as the framework. Let's take time. Let's the business will go down
Yes.
some percentage, but because see you are already exposed to your framework. The attacker already know your what policy you have defined.
Yes.
So if same framework and same policy will continue, as per the study, more than 80% uh, uh, of the company, they have got second time attack without changing their framework. So first of all, you have change your framework and
Yes.
policy.
Yes.
So we have done that things first.
Right.
Then we have established our SOC, where we have SIM and SOL has been installed. Your EDR has been installed. Policy has totally changed. Okay, so that we can uh, register any other attack. First of all, second part is false positive. False positive, it happens many times. See, it is a research organization. Okay,
Yes.
where the false positive it will come up. Someone is doing some activity he never done earlier.
Mm.
Okay,
Anomalous behavior.
anomalous.
Yes.
It will show you it is anomalous. Okay,
Yes.
but but actually he needed it.
Mm-hmm.
Okay, let's say one researchers he wants some data. He
Yes.
always will not access to our database. He
Mm-hmm.
has to use our database when it's required. So he has to do a study in a particular disease. Okay. So he want to search the data. When you search the data and retrieve the data, automatically my SOC will show that this is the IP. He is retrieving the data this much of amount, and he earlier he has not done this much of data. Yeah.
Yeah. Yeah.
So that alert when it is come, when you go to him and investigate it, then we came to know it is not like that. Okay. Second part is that AIMS is a organization for the research where lot of data plays a major role in our study and research. What it happens, the data are in the form of structure, unstructured, semi-structures. Unstructured means lot of medical images are there.
Images are there. X-rays and all, everything.
Okay, sometimes some segment of the network is down. Later past the image has been uploaded. False positive will come.
Mm-hmm. Okay.
Okay, to integrate that one, you have to make a one kind of policy that somebody is doing the this kind of things. What it will be, he has to inform to the authority. But it is such a huge organization; it is very difficult to do that. So someone is doing in the Sunday because a lot of researchers they prefer on Sunday because they can't be disturbed by the user.
Mhm.
Some of the majority of the researchers they do in the night because they will get a lot of CPU time, performance is very fast, and they will not get outside disturbance. So you definitely got in the night. Somebody is downloading a lot of data. Why?
So,
And it is also risk factor is there also. Sometimes you taken this likely the false positive also in that case it might be a risk. So this is the things we handle the thing. Yeah.
that's nice. One last question about emerging risks in AI, using AI in cybersecurity. What do you think, sir? What kind of risks do you foresee?
Yeah. See, already I have told you AI is transforming healthcare
Yes,
security.
sir.
Okay. But attackers are always ahead of us.
Yes.
Okay. But,
Mhm.
but at my policy, they may be ahead of us, but the gap between us and the attackers supposed to be less,
Less. Yes, sir.
so that you can contain.
Correct, sir.
And any solution we are keeping it. It is
Mhm.
not 100%.
True, true, sir.
Okay. Earlier the attack was happens means the attacker was inside my infrastructure for months.
Mhm.
Now it is within few minutes.
Yeah.
It is so fast because of AI.
Okay.
They are weaponized by the AI. The attacks are weaponized by the AI. AI power cyber threat is leveraged machine learning and automations and generative AI to, to bypass our traditional security measures. If we have a traditional security measures and they have AI power, AI has the power to manipulate many things, many conditions that can generate very fast as compared to the human brain.
Correct.
So the deep fake, social engineering, to the AI enhanced malware, to the organizations. So you have to think very seriously in this, because when AI they have, we have to fight with AI. So that's why I talk to my red team that you use AI,
Yeah.
okay, and blue team also you use AI, and you use different AI tools. So you will know that what it happens. The red times teams when you are using AI and they are exposing my weakness. Okay, whether the port is open, what time it is open, why it has not been closed, why it is open that much of time.
Mm.
Everything is calculating very fast.
True, sir.
Earlier, what it happens, one port is open to give a developer to test his applications, and next day is the Saturday, next day is Sunday. I have opened it and I return to my home. And Monday or Tuesday, Wednesday, I came to know that, oh, I have forgotten it. So this door is open that much of time to the attackers.
True, sir.
So that's why we're supposed to have uh, uh, some kind of AI based framework, which is I talk to my team that TDIR, threat
Mhm.
detection and um, uh,
Response.
no threat detection and investigation and response.
Response. Okay, sir.
You have to do the investigations.
Yes.
See, attack is happen.
Yes.
Uh, you have a huge infrastructure. It cannot be done in one go. Okay,
Yes,
so
sir.
if some portion of the infrastructure the the attacker has been compromised, so
Yes.
that has to be accelerated very fast.
Yes.
You got my point. So that investigation is required,
Correct.
and how to respond it very fast.
Yes. Yes.
Okay, sometimes what it happens in a government organization, what it happens during the Independence Day.
Yeah.
Oh, August 15 and January 26. It is Indian government sites get lot of vulnerability. Okay,
Mm.
so for this you have to be more careful at that time, because Chinese and other countries they are always towards us to make you in trouble. Okay, during this period of time. So what it happens? Uh, I say proactive action what to be done during this period of time, and what is the reactive mode up if it is compromised. Proactive means I have to do some mock drill. Okay, I have to assess all my past log. Is there any issues are there or not? Okay, if it is issues are there, then during my reactives, what to do? Attack
Yes.
if required. If it is more vulnerable and it is very difficult to control it, for few hours or few days, remove from the internet. If your business is not suffering.
Yes, sir.
Okay, so that is the extreme case I'm talking about, but we have never done it.
Oh,
Okay. Second part is that reactive modes. If something is happening, because it's a holiday, okay,
correct.
people, very few people are there, so you have to organize in such a way that if something is happening, how to react.
Yes. Sure, sir. True.
My backup is right safe or not. That is also to check.
Correct.
So these sort of things we supposed to take care of that when we'll talk about it. Second part is uh, UEBA.
Okay, sir.
Okay, user entity and behavioral analysis.
Okay.
That's supposed to be
Yes.
intact. Okay, so that this AI based it will come, because log is the only data with you to analyze it,
Oh,
and the log format, the AI people they change.
oh, oh,
Okay, the string they change it.
oh,
Then what application I have, whether he'll understand that log or not, you have to understand. If the log is unable to understand, means I failed to detect.
okay.
It is not a signal signature based any attack is there or any malware is there. Right now, it is a different form of it is coming up. Earlier, what we are thinking, मेरे पास firewall है. Firewall means all are secure.
Yes, sir. Correct. Mm.
Okay, and antivirus, two things. Access control, intrusion detections, very few people they have. But right now, these are outdated. We're supposed to have anything EDR or XDR or MDR or NDR or GTNA or web. Every application supposed to be AI enabled application supposed to be. Otherwise, you are nowhere. Frankly speaking, those who are outdated, this India, NDR, XDR, India, it is no use of that today's days.
Okay.
You are vulnerable. So that upgradation is required continuously. And the problem it is that it is a what it happens. We do all the logs to
Okay.
correlations. It takes a lot of time. If AI based is there, they can use correlation
Very
very
nice.
well defined, and the accuracy rate is very high.
Sure, sir.
It is not a manual system. If you do manual system, we fail.
Thanks. Thank you, sir. Thank you, Dr. Sushil. It was very nice talking to you today here. Nice to have you here, and it was really eye-opening for us because it was regarding healthcare, AI
Yeah,
in
yeah,
cybersecurity with respect to healthcare. It was
yeah,
very interesting, in fact. We got so many insights from your interview, in fact, sir. So I'm sure that AIMS will be doing quite uh, progressive work with respect to using AI in cybersecurity
yeah, yeah,
uh, in the coming future. And
yeah.
thank you very much, sir, for being here. Sir, Dr. Sushil, just 1 minute. Uh, they have asked me to take your testimonial for CSA, that is Cloud Security Alliance, whom I am volunteering for. I am basically working for the SDM Institute for Management Development in Mysore. Actually,
Okay,
I
great.
volunteer for CSA, sir.
Yeah, okay, no issue. Yeah, yeah, yeah. So I agree to it, not issue.
So, your points means your opinion on CSAs, Cyber Security Alliance.
See, my opinion is it is a good initiative.
Thank you, sir.
Okay, first of all, second part is that how I have started. I'm talking about it. After the AIMS attack, I have started to train to the people, the teenage people
Yes, sir.
from different school, old age home. I've gone to the old age home,
That's
and
amazing.
yeah, and the people those who are underprivileged societies. I've gone there and I give some times with them. I teach them
Yes, sir.
voluntarily.
Okay, sir. That's very nice, sir. That's great initiative, in
Yeah,
fact.
yeah, yeah,
Thanks for doing that, sir.
yeah.
Thank you very much for being here, sir.
Okay,
So,
thank you, thank you. Yeah.
yes, just